Hmm.
There you go. Still talk. I mean,
Okay.
Just
I don't know.
normal.
I've been on a podcast one
that mixer's
time,
just good.
so I don't really know the ways.
Me and Scott have done shared mics before.
Sweet.
It's I don't know what's going on, but I think I'm trying to figure it out. It hits every time. Let's talk about the live.
Yeah.
I know when we do it like a regular like podcast, you don't have that kind of heavy noise, and I hate that noise.
I don't think I've ever done a live with you. I think the one that we did with making groceries was like chopped and screwed. Like y'all had a minute to like.
Yeah, but we did it at your restaurant.
I know that was so much fun.
It was.
Did we even accomplish anything? Was that even like a cohesive story?
I think so. We had plant-based food. That's like the first time I ever had plant-based food.
You're welcome.
And you made a bunch of food, and then we toked a little bit.
Uh-huh. And we drank 1,000 beers.
1,000 beers.
Thank you, Chandelier Brewery.
Thank you, George O'Keefe.
Thank you, George O'Keefe.
Which
I think there was some Braided River probably thrown in there too. That was before Fly Llama's time.
I thought it was a cool concept though, was setting up, doing a little cooking show.
That was fun.
It's different. Yeah. I mean, I enjoyed it.
Yeah.
So when you're like in a museum, I mean, that was kind of cool, but
yeah.
All right, let's go into, I'm going to let Lauren Turner, shout out to St. Martin, but Lauren Turner, introduce
Sting 'em.
You and your friend and your organization, right? Because y'all are an organization.
Yeah.
And just go ahead and give a little feedback. And we're going to dive right into the show. I know it is. I know they raise money and they raise awareness, and you can get a medical card through you guys.
Well, we
connect each other
with practitioners.
Yeah, but that's still like, I mean, so it's kind of like a hotel.com.
No.
I don't know what that means, but I don't think
not
so.
Like the great. That's kind of gimmicky, and that's not where we're at. We're at the core.
All right, gotta bring your mic up a little bit here.
We are a patient advocacy organization at our core.
Yes.
So Liz and I have been friends for like a decade.
At least.
Yeah. So her and Corey were real tight. And I think like we've just really become tight in the last like couple of years.
Yeah.
You know, through yoga and other advocacy things. And so she started Mississippi Patient Voices and just asked, I was kind of between gigs, and she asked me if I would help with the patient drive in Ocean Springs. And that was the first patient drive we did.
Yeah.
I think I'm kind of getting ahead of us. So like, this is Liz. She started Patient Voices. Like, you take it. Like, you tell us.
All right. All right. Okay. I'll jump in. So I'm Elizabeth Feder-Hosey. People close to me call me
Lizzie.
And I'm the director of Mississippi Patient Voices. We are a political action committee dedicated to expanding access, education, and empowerment to medical cannabis patients and prospective medical cannabis patients throughout the state.
In person or online too?
In every way possible. So we are, I don't know if there's a what's going on there, but
I'm curious.
We're everywhere.
This is a different organization down here.
Yeah.
I mean,
we are everywhere. We've done patient drives in Ocean Springs, Gulfport, Starkville, Greenwood, Tupelo, Olive Branch, Richland. And then we've got
Gulfport.
This pink dress run coming up where we're doing a patient drive. And then we'll be Hattiesburg, Jackson, Oxford, and Tunica.
Is it like festivals and events, or y'all just have like, do y'all set up like by yourself, or y'all just always hop into like local community events?
So we are typically a standalone organization and event. And it's not a festival by any means. It's an educational expo where people can come, they can learn about the endocannabinoid system, their patient rights, the statute itself, all about shopping, the vocabulary words required for being knowing about medical cannabis. Now I'm telling you what, when you go into your dispensary, you will hear words you've not heard before.
What? Yeah.
And so what we do is we bring doctors to a location, and we offer $50 patient cards. And that is through, patient card subsidies, and then also through the generosity of our practitioners who are participating in this. And so we found through data collection that the cost of seeing a practitioner is the biggest barrier to becoming a patient, in addition to lack of information about the program itself. And so that's why we offered the $50 cards or $50 doctor visits, because we're not guaranteeing cards and we don't have authority to do that.
We're not practitioners. We don't know your medical history.
We offer that $50 doctor visit. And then also the community support of going through the Department of Health, filling out your online portal, and just kind of reassuring and guiding people, because they show up to us. They are afraid they're not going to get their card. They're afraid they're going to get in trouble.
We see so much.
Yeah.
Like
people
we were just
struggling.
telling Scott, like we see, because we travel across the state, we see Mississippi's different regionally, and we see all these people. So as we travel, the specific needs of each demographic of the towns that we visit are different. So, I mean, I can't even.
Some are more tech savvy.
Yes.
Some
require new email addresses, don't have debit cards, don't have phones. We've encountered so many things, and I can't remember when we implemented the tech support.
Yeah, we implemented tech support right after our first drive.
Shout out to William Thompson for being the realist and holding me down at the tech table, because I certainly could not do it without Wilhelmina.
Yeah, Wilhelm is the tech guru.
Tech guru.
He can solve every problem that there is.
All of them. He knows it. Well, he's a scientist. So like by nature, he's a problem solver. Yeah. So we're incredibly grateful for him.
So the question I have is, why did you start this? What was a seminal moment when you said, this is something that we need to do?
So I'm a medical cannabis patient, and I had some people in the industry who were like, you're an attorney, you're a patient. We really need, things to change. We need better patient access, and nobody's really getting anything done. And so I went up to the Capitol, and there was a big meeting, a huge crowd. Mostly it was cultivators expressing their concerns over some new regulations. But at no point in that meeting did anybody stand up and speak about the needs of patients. So I took that opportunity to stand up and talk about the needs of patients. And I also talked to legislators to find out, hey, what do you need to hear, or what do you need to see happen before you want to get more involved? And the legislators need to hear from voters, because all they're hearing from is the industry right now. And we didn't really have a patient advocacy group before. So Mississippi Patient Voices, I created it. And we started with a patient drive and a golf tournament back in November of 24. And then
Hold on. Go ahead.
But so anyway, so by the end of May, or by May, I developed a plan for this statewide patient drive campaign. And at first I said, let's do 100 patients in a day. And we were absolutely gobsmacked when we had 100 people lined up an hour before we opened.
Wow. I cried before it even started. I don't cry anymore until it's out.
When the industry got started, as you know, there weren't the system to get a card to become a patient, if you will, really was not very supportive. I mean, it's one of the problems that the industry had was that there weren't any. You had a product, but you didn't have anybody to come in and buy it. Okay?
Correct.
Still,
and have you seen a change as a result of what you've done?
Yes. So, I can't quantify exactly the impact that we've had, but I do know that the dispensary partners that we have are verifying that they are having new patients come shop. So the communities where we've done this, the dispensaries are feeling that impact. And according to the Department of Health, patients spend around $200 a month on their medicine. And so we've done around 1,500 patients since June. And so do the math on that. 1,500 times 200 times 12.
It's super.
Since June.
It's small. Like,
Since June.
It's like it jumped fast for you. That's what I was saying. Like 2024,
So September of 2024,
That's huge, though,
I
from
started this
now.
thing.
We did the golf tournament.
We did the golf tournament, and then, you know, we didn't really get anywhere. I still was trying to collect data, figure out how to engage. And then
Well,
when
you had
I
events and like you did other
we did
things.
other like little events and stuff. But like I said, I was, you know, one of my confidants and we were talking about it. I put this plan together. He said, let's do 100. And I said, yeah, let's do it. I did not anticipate the response. And so from there, we've really kind of honed our procedures. And
So you're talking about 13 months, huh? Like 13,
so
24, 25, what is it?
September.
No, we've been doing these
a
drives
year.
since June of this year.
Yeah.
When did you hit, like, so
June of this year.
Patient Voices
June
is
of
it
2025.
1 year
What?
old.
June of 2025 is when we started. And we've certified 1,500 patients since June.
So it's really getting out there.
Yeah.
I mean,
yeah. So in every region is different, right? So we've been kind of looking at the patient count in that area compared to who's showing up. And so, for example, like the last few we've done, we've had around 140 to 170. But then in August, we did 305 in Tupelo. And I don't know why or how, but we just were
really
like,
don't know
we're
how that
going to do
happened.
that. And we did it. But since then it's been less than 200, but that's fine. We get to leave
I
on
want to go
time.
to Philadelphia.
We've got all sorts of places we're going.
But
so Meridian is a place that's kind of on our, like there. So we're trying to assess data to see where the needs need to be filled. Also where it makes the most sense. Like we can't do this for free either. Like we need sponsorships in the area and we need resources in the area, you know, because we're traveling all over the state. We don't know these places.
We have to book venues.
Yeah, we have to book venues.
Arrange for practitioners to
security,
be there.
things like that.
I was so blown away when I went up to Philadelphia, Mississippi, when they had a casino up there. It's a whole different world.
Well, we'll be in Tunica.
Yeah,
we'll be in Tunica later this month.
In Oxford, right?
And we'll be in Oxford as well.
Could be a big area though up there.
Yeah,
just because people need the help and need to understand it.
Yeah, we are definitely noticing trends about where people are needing what kind of help and making those accommodations as we travel to those specific areas. Now that we have data, now that we have experience in those towns. So like, again, our goal is to just serve the people to the best of our ability.
How many people signed up for a medical card so far altogether? Like the medical card.
The overall, I want to
55,
say
60?
we're 62,000.
Is that right?
Yeah,
it's like somewhere in the ballpark.
Somewhere
of
around
62.
60.
Yeah, it was last time I looked, it was around 50, but I'm sure it's grown some since then. I would think the rest of the industry would support what you're doing. I would think the dispensaries, the grows,
they
because
definitely
they don't have that's been the problem the industry's had all along is not enough patients.
And they are very supportive. They are very supportive, but we have had a lot of backlash from practitioners who don't like that $50 option because they believe it's somehow cutting into their bottom line.
I mean,
and affecting their businesses.
Yeah, it's like, I mean, you're taking away from their profits.
But they weren't coming in the first place.
I know, but come on. I mean, that's the truth though. Like it's an extra added income to them having, you know, like I was saying earlier, like can funnel other opportunities for their businesses. As y'all going in and you're focusing on one thing, you're not focusing on, 30 different things. You're focusing on one thing. Like, so it makes more sense. But when you got, you can add it too, but you're going to add Botox, you're going to add everything else. And it's money.
Yeah.
Cause like you have to like the renewals and stuff. I mean, was it normally like $200 for a card?
No.
What's it now?
No, it ranges. You've got anywhere from $100 to like $250 to $300 on the high end. I think the average is probably closer to $150.
Yes.
But so these are my thoughts on the practitioners who, a lot of those patients weren't coming because of the price point. So you weren't going to get those patients. Similarly, legal clinics, free legal clinics here. Okay. I'm not going to try to shut down the legal clinic because they're giving free legal clinic services. Those people can't afford me.
Beautiful.
There's other people that can, and that's who I need to worry about. You know what I mean? And so, yes, I'm sure that, some have felt a little pinch or a few people haven't showed up. But, people need access to this, and every person who gets their card is going and then talking to other people. And if you have a good, if you treat your patients well and not in an exploitative manner or a dismissive manner or demeaning manner, then they will return to you and they will be loyal. And then the economy is really bad for a lot of people right now. So they're just like, if I can get that $50 card and stay on my medicine, and that's what it takes to keep them in the system, I think it's worth it. Even for a practitioner who didn't get to see that patient.
You looked at, like you said, a few months you've been at it, 1,500. That's a big chunk of the market because it's been around for a while. I mean, 1,500 is a lot. I mean, you remember when it was trying to get up to 10,000? It's just one of the things where it's like, that's a lot for you to jump in. And I mean, that's like, I'm with Scott on. I think people should jump in and be a little more supportive towards what you're doing. I mean,
we think so too.
They are. No, they are. And like
most people are, like the cool ones are. The people who have like ego problems or are clearly in it for the wrong reasons don't support us. And I will say that most practitioners support us.
Yeah.
Shout out to the Trulies. Shout out to the Privets.
Yeah.
Who else? Who else do we need? Cassie. Who else?
Yeah. So Cassie, she's up in Oxford, but that doesn't help y'all. But on the coast, yes, we've got the Truly Family Healthcare Clinic. They're actually going to be at the Pink Dress Run with us, writing or visiting with people for free. Especially, cancer patients or people who donate money to come join the run. They're going to offer free appointments for those people as part of the cause. I thought
that's the reason I've kind of partnered up. It was, my call on top of John's, but it was my call to jump in, and it all started with Con Life.
Amazing.
Yeah. I recall that.
It was Jason coming on the podcast, and it was actually Derek. Remember Derek from, he was a part of Adam Ship. He owns was it Cultivate? Cultiva? Is that it?
Cultiva RX.
And he's like,
what's up, Derek?
And I walked in and he was like, hey, that time they had Planet of the Grapes. Like they're doing Ace for $20. And then Derek's like, Jason, you need to go on his podcast. And we're like, I was like, huh? And he's like, yeah, podcast. And Jason started talking. He's like, yeah. And then Derek's like, there's a grow out of Pascagoula. So I just sat there and chit chatted with Jason, which is their general sales manager, and had him on the show. They jumped like 30 or 40 stores just talking about it. And then it was John Jordan. I was like, well, I want to get the grower on. And then John Jordan came on, and it was like, mate, dudes
that normally lurk in the shadows.
Well, John is that one. Like John's one of his words. He's his biggest critic. And we did that podcast together. And then after that, he looks at me and goes, we got to do something together. We got to make a strand. I was like, do it for my charity. And then we created, it was fuck cancer. It was fuck cancer, but with asterisks. And then that they did like 16 pounds and it sold out like that. And then they just dropped
some.
Yep.
And I was like, I wanted to have a person that was like seeing what we were doing for patients. And I was so big on, I would rather you try cannabis over an opioid or a Lortab or a painkiller. And John knew that, and he went to it took him about, I think, 7 months to really figure out what his strain was going to be like. And he sold it. He goes, Jordan, we didn't know it was going to hit like that. And then
that's great.
They just dropped last week. They just dropped 1,500 pre-rolls.
Of the F cancer?
Doug bought them all. Starbucks bought them all.
All right, cool. Then I'll see you.
But it's one of the things because he sees, but also with his wife, I mean, they see the vision too, and that's why you were brought to the table too. And
Doug and Krista is so quick to be like, so I had a crisis where I thought I lost my laptop. You remember that?
Yeah.
And like all the Starbucks people were like, we have like 1,000 laptops. So like, they're like, we will fix it. And then like not like half the staff like over there trying to like whittle my little tech station to like make it happen for me. So like they've been really
super supportive.
of us. Thank you, Doug. Thank you, Krista.
At the front of it, when we were doing what, we were already focused on, we've been at this since 2016, and it's been tough doing this. I mean, you can see my body change because it's under a month now. It's under a month, and things got to get done. They don't get done by talking about it. It's actions, and that's what we push. And it's been a great experience. But I remember when I told John about it, I was like, "Yeah, we're about to have our own medical marijuana." And I thought John at first, there was what?
Don't be telling people you're gonna have like medical marijuana there, dog. Like that's
no. I'm not talking about at the run.
He means their own strand.
We're talking about branding.
Okay,
so
branding
goes a bit further for us. People don't realize the power of a collaboration package.
Oh yeah, no, for sure.
I mean, because you're like you are seen. We're not going to have any cannabis there, but we jumped ahead of everybody before. Like they were nervous about doing it. We were like, let's do it. And it was a decision between me and John. And it was, no, let's do it. And most people at the time were like, that was what Doug told me today on the phone. He goes, I want to say something to you. He goes, I want to say thank you because y'all stood up for allowing us to be a part of this. And it's like most people, like it's one of the things where if you look at how when the cannabis first came out, you go look at the old cheesy events they were doing. And it was like, I was more aggravated on how people present cannabis. It's a different way. It's a different way. It really is. It's more of a, down here on the coast, I'll say it, like there's people that still have it in their mind. That's like, you can't use cannabis and be successful.
There are still like massive stigmas. And I will say like, that is one of the core missions of
patient voices
is, breaking stigmas. It's like one of the things that we say so often, it's super normalized for people to go downtown and consume like red Solo cups full of whiskey. Cheers, Phi Llama. You know what I mean? Like, but why is it stigmatized that we're just like smoking a joint? Like, why is that so different when there's scientific evidence that there isn't as much harm and there are medicinal benefits and, there's no medicinal benefits to alcohol, like sure you can use it for a tincture or something like that for a medicine, but you see what I'm getting at?
Yeah. I mean, but that's how it's always been down here.
No, I know. And like, we're just fighting to make it more normalized.
Yeah.
And as a safe alternative to consuming unsafe substances. We all know people in recovery.
And have lost people to drugs, alcohol. And when I say drugs, I mean pills or meth or some intravenous thing or alcohol. And a lot of those people, if they had access to cannabis and it was legal, they might not have had to go rely on those other things to self-medicate.
Right.
And then too, in talking about the stigma, I've been thinking about this a lot lately, because we keep having this stigma put on us about saying, oh, it looks like what you're doing is too recreational.
Like, what does that
mean? I'm like, what does that mean?
Like, we're an information drive.
But like I'm thinking about like cancer patients who are sitting around and you're having a cancer support group. And let's say you're all happen to be on your medication at the same time. Why is there no stigma about those groups or any other medical support group that you need people because you're having grief or something?
Right.
But if medical cannabis patients want to gather and talk about our stories and use our medicine legally, then that is somehow seen as a party, as opposed to patients sharing each other's company, telling their stories, teaching each other new techniques.
And I will tell you, like, even at some of the most because there are some more recreational events that you can attend. They're not Patient Voices affiliated, but I've been in the industry for about 1.5 years, and they exist where there's, a lot of consumption and things. And I'll tell you, at the core of those gatherings, it's storytelling. How did you get here? Where were you before? What's your experience like? How much have you grown? How much have you healed? I swear to you.
What have you been through?
Can I read this real quick? This is what
this from?
I was a friend's mom. She's in her 70s.
Okay.
So this is what I mean.
Okay.
But went to the orthopedic surgeon today, and he said your healing is amazing. 73 years old with 2 fractures and has completely after only 5 weeks. I told him my friend gave me some THC oil and some Nobles, and he said it worked.
Yeah, it does.
I love you.
It does work.
I only have to wear my boot when doing extra for 1 week, and then I'm free.
Amazing.
And that was like,
that's amazing. Good for you, sister.
And put some oil on it. She did it, and it really changed her pain levels.
Was she doing a topical?
Yeah, it was the Noble, which guys don't realize too. Topicals you can go get.
Yeah. I was just about to say the same thing. Yes, you do not need a medical card to go purchase a topical.
And it really does. What her doctor said, keep going, stay on this.
Yeah.
It's you don't have to have a card to go get this, but this is just one person that's been through a lot that was in pain, and I'm like, no, I got some oil. And I know the benefits of what it does. And that's like, for me, I believe in the product. I fully believe in, I mean,
I don't know how anyone who's had firsthand experience in the medical program can't believe in the product. Yeah. I've seen grandmas like standing up straight and able to chase after their grandbabies in the yard and stuff. And like people able to function in social settings that they haven't been able to function in years. Just so many, people getting off pharmaceuticals, just so many stories. You see a lot when you work in a dispensary. You see all of it, and you see all of it working.
Or counting your pills at the end of the month and realizing you didn't need them all.
Oh yeah.
You know what I mean? Like that
titrating.
Was for me, like when I was like, my prescription for my anxiety medicine's lasting longer. And there have been times where I could microdose a gummy instead of taking half a Xanax.
Yep.
When I had to go to court or something. So I am able to be fully present, but not, not just rattled and completely disheveled because I need to be medicated, or I'm going to, take a Xanax and be sleepy, or I can microdose a gummy and no one will be the wiser.
Recently I visited with my regular doctor, and I asked him about cannabis. I got something out of the dark ages.
Oh, wow.
Reefer madness.
Yeah. I mean, totally bad. Everything about it. Don't do this, don't do that. And all the reasons, and it's all the old stuff.
Reefer madness stuff.
Do y'all have any thoughts? It seems to me that an integral part of this educational process that you're about is the medical community. They opposed it in the first place. And in fact, the Board of Health opposed it, who regulates it now. Okay.
And they're opposing patient voices too. So the certain practitioners have definitely been the biggest impediment to expanding patient access. And like you said, the medical board didn't want to approve it in the first place. So that's a huge challenge that patients face, is having to overcome the medical board and their resistance to it.
Again, that's stigma. It's stigma,
Sure. But
how many doctors teach you about preventative medicine?
Right. Is there any thought on how to educate doctors at large?
I'd love to see physicians who are in the field take that under their wing. But I don't know that they're doing that. And Patient Voices has so much work to do. We would love to educate physicians and other practitioners. And
if there's any practitioner that's interested, hit us up. Just send us a private message or send us an email.
Teach you how to become certified.
Yep. We can come talk to you about it openly, candidly. You can ask us as many questions as you want transparently, and we'll just answer them.
Because I think, when people have more options, and it's just more commonplace, because one of the other bigger problems of the program is there's an advertising ban.
Right.
Yeah.
So the medical cannabis companies can't advertise. I don't recall the advertising rules for the practitioners. But yeah, so there's all these crazy like rules where you can't advertise, but then you can have shops that say candy shop with a big, fan leaf on it that just sells
fake dispensary
kratom.
signs too.
And like fake dispensary signs. There's also billboards leading into Louisiana telling people to come shop for cannabis there. So
don't, because their system's so weird.
So it seems like our state needs to get it together.
Yeah.
We're either going to let medical cannabis advertise with everybody else, or we need to crack down on these other advertising schemes. Because Louisiana is advertising their medical cannabis program in our state.
Where?
When you're over in Gulfport and you are headed west. Yeah.
What the heck?
Yeah. It's Good Day Farms. But
oh, shocker. Well, they're like the only market in Louisiana.
So, but anyway, yeah. So that's another thing is that none of our businesses here can advertise. And so people don't even know where to go. They don't know that you have to go to a special practitioner to get your card. They don't know that, what conditions qualify,
what the average cost is.
Yeah. So there's
what the qualifying conditions are.
The one key element that you do have is that all these dispensaries and their license, because I'm an attorney, I've licensed some dispensaries, and you always have to have an element in there about education in the community, reaching out and doing all of that. So that's maybe the place where you can do enough marketing, if you will, while you're
our events are educational. So we teach about the history of cannabis prohibition. We teach about PTSD. We teach about your patient rights. We have this artwork that we put out on easels, like showing the statute, what that means, that,
rights,
your gun rights.
It's a big one.
Law enforcement can't confiscate your medicine, what is probable cause, and all the rights that are laid out in the statute. There's a whole section of patient rights in the statute. And so that's what we focus on.
Yes. Please check out your patient rights. If you have questions about being a gun holder, purchasing a gun.
So what is the role in the gun holder?
So it says when you fill out your application, do you use illicit drugs?
This is the federal application.
Are you using illicit drugs if you have gone to a medical practitioner and they have said, hey, why don't you try this instead of your opioids? Because I'm a doctor and I went to school for this. Is that then an illicit drug? That's just a question. Like,
this is not legal advice in any way.
This is not legal advice.
So there's a gray.
This is a question.
There's a gray area.
Huh?
Well, so Mississippi law explicitly protects your Second Amendment rights, and the Supreme Court in the Fifth Circuit recently came out and said that being a medical marijuana holder is not what the founders contemplated with restriction to any gun rights. Like, this is preposterous. So the Supreme Court's on our side. However, the fact that it is still a scheduled drug for the federal government, they have that on the form. And so, it's up to you, right? Were you being truthful before you got your card anyway? Like, were you using before and then you check the box? Or anyway, so the point is Mississippi protects your rights. If you took it to the Supreme Court, you'd probably win. The federal government
sounds like a gray area.
could
also
always come
not
after
legal
you.
Advice.
Yeah, and none of this is legal advice. This is just we are
on a podcast talking about just
we're having a conversation about the Constitution, patient rights, what that means, statutory interpretation.
But
all
without
those good
advertisement, you can't really have a voice. Like, so people really do. Look, I'm telling you, like, it's a serious thing. Like, it's a very serious, like, I have people all the time that will ask me about this stuff because they've listened to the podcast and they're like, I don't, look, I tell you what, some people don't take well to gummies. I'll be honest with you. There's people, everybody's different on whether it's sativa, indica, the different strands. It's a whole different thing.
Sure, definitely. But, I wanted to touch on Liz talking about the microdosing of the gummies. if you guys aren't familiar with that, that's taking like the lowest dose of gummy that you can possibly buy at a dispensary and cutting that like into quarters.
So you're saying like 2.5?
And like you're starting with like 2
Yeah.
milligrams. And if anybody at the dispo, if you have zero experience with cannabis and anyone at the dispo tells you otherwise, I'm so sorry that you had that experience.
Never eat a whole gummy your first time.
Your first time. That like it will go away, but you feel like it will never.
There's a lot of people who
Poor things. That's not a good time.
They've had a
I've seen it.
They had
Allegedly.
a bad gummy experience, and then they don't want to try to get their medical card because of it.
Yeah.
But so another thing we do, we teach people tips for success. They get a patient journal, and the tips for success are just this. We teach about microdosing. CBD. Like if you smoke some flower and you feel like you're too high, you're paranoid, something, you can take CBD within 20 minutes.
You can also do a bath bomb.
It's done. You know,
like you
could take a bath.
I love bath bombs.
Who doesn't love a bath bomb?
Take it easy, like I said. It's more to take it easy.
Yeah, and so if you do feel bad, we tell you what to do. Eat a snack. Lay down, chill out. You're not going to die.
Hey, calm down. It's just weed.
It can't cause a fatal overdose.
One of my favorites. Is a cart. Take it down a notch, like a little cart. Take it down a notch, like one little hit. Wait an hour.
That's like a microdose.
Yeah, that's a microdose.
Yeah, just like wait an hour. Yeah, like
you can microdose any cannabis product. You don't have to smoke a whole joint. You don't have to smoke a whole bowl. You don't have to do multiple dabs. You can just
that even goes for like tenured users, I would say too, like dose yourself properly.
And I like the journal situation because I've, before dispensaries and medical marijuana, and I discovered my own way to do it because, with me having cerebral palsy, there was always lower tabs and somas for me. So I was like, I'm getting off this shit. I'm getting off shit. I
can't even imagine.
Yeah. I always had that, like my pain levels, but but I always treat it with like, I'd always do like 9 a.m. like a 9 a.m. 2 hit, and then I do after lunch 1 hit, and I'd start spacing it out. I treat it like you would just take an ibuprofen. To me, is like,
oh, totally.
You don't want to take the whole damn bottle.
It's like the Dave Chappelle tussin. You know how Dave Chappelle's like, just put some tussin on it. Like literally, do you have a little anxiety? Tussin. Do you have a little pain? Tussin. Are your kids bothering you? Tussin.
If you run out, you shake it up, put some water in it, shake it up.
Tussin.
You got Motussin. Was that Chappelle or Chris Rock?
I think it was Dave Chappelle, wasn't it?
I've watched the clip. I don't remember that.
You put some tussin on it.
Yeah.
Is there sure? It might be Chris Rock.
I don't know. Y'all tap in and tell us.
Yeah. Who was it? Was it Chris Rock?
Who was it?
Who's putting Motussin on it?
I was seeing that situation with
Rush hour.
With Lord tabs. I mean, I can go to the doctor right now and get so many Lord tabs or
for $8
so easily.
Yeah.
That's a bummer.
Because I went to Shriners. I'm a Shriners kid. I just hand you all my surgeries, and they're like, oh, and every doctor would always be like, just take. You need this. It's just a Band-Aid. And then I was like, shit, I don't want to learn about marijuana. Like, I'll be honest with you, that's how I call it. This is my show. So everybody knows that I've always talked openly about this. But I was like, I'm going to do it, but I don't want to do it where I feel like I'm stuck in a couch. Like, I'm not going to do it when I'm stuck in a couch. I really would just,
there's different kinds.
I would just, no, at the time when I was learning it,
Corey Christie cannot consume cannabis.
Yeah.
Like, he got his card for CBG tablets. Shout out to Mid-South Extracts, exclusively because it was like helping with joint pain and things like that. But I mean, if he hits a vape, it's to go to sleep for 12 hours.
Everybody's different.
Yeah. He can.
Don't go in this, don't go in like, I'm not a person that can go and smoke a whole entire blunt, right? I wouldn't do it. But there's people that can. There's different tolerances. A lot of people have been in the industry, but like my biggest thing is I've seen the benefit of how it helps people. I've seen through anxiety and stress, pain, as a person like me going through pain, it does make it better, and
without side effects.
Yeah.
I mean, outside of like the munchies.
I mean, maybe you wake up with a little in the morning, you might wake up and you're like, a little cozy. and you're like, you know what? It's still a good day though. You're not like, you wake up and maybe a little, sometimes maybe you wake up and there's like some sour stripe somewhere.
Right. Or like, some nachos cookie on the wall where you like,
but it all comes down to your consumption. Like, I think I think I've met too many people that have been in I think when I started doing the charity is like to see people now that there's so many people that are survivors that are going through cancer that sit with me and talk to me about their cannabis use. I'm not gonna name their names, but it's very touching because it's like, I'm eating better, I'm feeling better.
Dude, it's like not just cancer though is the thing. Like, I mean, I've seen, 7-year-old women with arthritis that weren't able to stand up straight or like open their own drink, like go from that to opening their own drink and chasing their grandchildren.
I've seen studies on seizures.
Oh yeah, seizures. There's so many debilitating conditions that it helps with.
I'd like to chime in on a topic that is going to be something that the hopefully legislature is going to be taking up with regard to medical cannabis is the concentration caps.
Oh, yeah.
So are you familiar with RSO? So RSO is a very potent THC formula that is very good for cancer patients. And it's been known to actually fight cancer itself, and then it helps with pain and everything else
Your appetite. I mean, all the things for treatment, but it also, because of the high concentration, it's essentially like 100%.
Yeah.
It's all of the medicine fully extracted without any solvents, which because of our concentration cap, it requires processors to.
Are you familiar with this?
Yeah, so we have a concentration cap of 60%. Of 60%, which means all of the concentrates that are made in this state, if they test over 60%, they have to be diluted with some other substance, whether it is terpenes or CBD,
which you don't want that.
or other sort of filler substances, and that's all we have on the market right now. And so RSO cannot be made in this state because of that concentrate cap. And so we're really, our cancer patients in this state are really the ones with the biggest disservice, because RSO is the medication that they need the most. So this legislative session, there's going to be a lot of engagement in terms of trying to get the legislature to remove that cap completely. But I felt like for this topic, we're talking about cancer patients and RSO, that miracle drug that they need.
Right.
And unfortunately, Mississippi cannot provide that.
And even if it's like a thing where, you have to have specifically cancer or this chronic acute seizure disorder or whatever. Hi, Barbie.
Hi, Barbie.
Even if those are the qualifying conditions you can have to have that RSO recommended, like whatever that means, like we need to get that medicine accessible to our.
We just got to get rid of the concentrate caps.
And
do you know the levels of that?
So, you're going to be having anywhere from 70 to 100%, in terms of what could come out.
Mm-hmm.
And I know that in most states, concentrates are usually around 80%. It's a shame because we've got this diluted medicine. It's ineffective, and it's actually more expensive because of the extra processing. And then we have to buy it more often. Right now, when you look at the pie chart of consumption, essentially 60% of consumption is flour in this state, whether it's pre-rolls or just straight flour, which is what you smoke, for anyone who doesn't know what that means. Whereas concentrates are much cleaner and would be a much healthier alternative for a lot of people whose smoking has caused them some lung problems. They could switch to concentrates, but again, we don't have those effective concentrates because of the cap. So that's a really big issue. And as we get closer to it, there'll be some calls to action so people can reach out to their legislators and really talk to them about how, RSO is something that we need for the sickest patients we have.
I mean, what do you think about that?
Well, the first thing that came to my mind was you're going to have to limit it to, as you say, the sickest patients. so that it's not something that's generally out there, so that we're limiting it only for if you meet these certain criteria like you were describing.
I mean,
at least
if that's what we got to do to get it in the hands of the correct people, sure.
One step at a time.
One step at a time. If we got to baby step it, we got to baby step it.
I'm not ready. I don't want to baby step it personally.
Nobody does.
I'm
but
a
if that's what
concentrate.
keeps everybody happy. That's what keeps everybody.
I'm a
happy.
concentrate user, and I would like to buy unadulterated concentrates because they're cleaner.
Yeah,
you know what I mean?
It's hard to find clean
RSO. Yes, RSO is not
really
something
hard.
that I'm going to be using.
No, definitely not me
But
either.
that's not. They're different. They're different types of concentrates.
You have to remember where we live.
Right. No, that's why I say what I say.
And the voters that the legislators who might support it have to respond to back home.
Mm-hmm.
Think about how long we've had prohibition on alcohol in Mississippi. It wasn't until last year that we did away with prohibition as the policy of the state.
Yep. I know, Banana Town. Banana Land.
Yeah.
It's fine. One step at a time.
But
we're going all in. We're rallying.
I mean,
everybody in the state.
Ask for everything, and just be ready.
Yeah.
Oh yeah. Like
as an attorney,
not her first.
I know
rodeo.
what you're saying.
Yeah.
Kitchen sink. See what you get.
Yep.
Yeah.
Got to ask for more than you're gonna. Than you want. We expect.
Yeah. But I feel like that one little thing would be huge for patients.
Mm-hmm.
And I know there's, people would prefer an increased allotment. I don't know that that's been discussed much, but the advisory council for the medical cannabis program has recently established some subcommittees, and so hopefully we'll be able to ascertain more of the patient needs and desires over the next few months.
Yeah, this sounds like a critical one, though.
This is a critical one.
Yeah.
Concentrate caps have got to go. Just for everyday users, because that's vape pens too.
Mm-hmm.
We're talking about your vape pens are cut. All of it's cut. If it's not flour, it's cut. And then the flour has a 30% cap on it too, which is seems
sadness and sorrow.
Yeah. So a lot of times growers, if they test over 30%,
like sorry for growing that on accident.
They can't do anything with it unless they send it to processing or something. So, but I feel like that's more of a benefit for the cultivators.
How often do they grow and it hits too high of a level?
Not super often.
Okay.
I
don't know enough to answer.
I don't think it's super often.
Yeah, but
like also, why should you? I don't know. There is a time and a place for that incredibly effective medicine, just like concentration caps. Like that's a 9-nighter. Like that's gonna put me 30%
THC.
That's gonna put me out, and by the grace of God, I may sleep past 3:30 a.m. So you know what I mean? Like, and that's why concentration caps aren't great. Like, you're spending more money on your medicine with those concentration caps.
Is this normal for most states, or is this our state? I mean,
I think, every state has a different program, and I can't tell you like the breakdown. I just know that some states don't have caps and some states do, and that people are getting their concentrates from out of state because they're uncut and they're not coming into our program because that's what they prefer.
Out of state.
So, so there's a lot of.
So you're saying like Denver?
There's a lot of stuff coming out of Oklahoma, I think, Michigan,
Missouri,
all sorts. I don't know. I've not heard of this. But
a lot of people get stuff from Colorado. Like that's been a tale as old as time. Yeah. You know what I mean? Like it's just.
So by having the concentrate cap, the state is kind of perpetuating the illegal activities because people need the uncut concentrate.
I think it's more about, I would say advertisement for me would be a big plus for the state and education where you can advertise, because I like when I took on, because we were so large, and we 100% of our money goes to the hospital. We don't have a bank account. There's nothing you can, you can talk to Catherine, you can talk to Amy, you can talk to the whole team. We just literally raise money for the sick. And when people have seen that, when we took that mission of give them the option of education, that was a no-brainer for me and John to say, let's do this. Let's give this opportunity, because people ask me, so it's a question I get asked all the time. It's like, would I even like, getting a medical card, or would I even like even trying it? Because there's always because you don't really know. Like you're hearing about it. That nobody knows how to get a card.
The $50 card option, right? There's people who are like, we're not sure.
I don't even know if I'm going to try that. And that's a huge front end cost if you're unsure.
And then what if you go and they deny you? You know what I mean? Like that's a huge thing people worry about.
Or you know how often, this is incredibly unfortunate, which just definitely really drives your point home about the necessity of education. People have really bad experiences their first time in dispensaries, unfortunately. If you go to a bud tender that's new or hasn't been adequately trained,
or not passionate about it,
or not passionate about it,
you have to be passionate.
God, dog. And like, I will say that I don't think that that's incredibly common. And I think that most bud tenders do it because they want to help the patients. They just might not have the adequate tools and support. But if that patient has spent in excess of $200 to obtain their card, and then they go to a dispensary for their first time and spend $100 on something that wigs them out, they take a whole gummy, whatever.
Yes,
they are,
or a 30% flour,
or a 30% flour. Good Lord,
on their first time.
Or like some kind of crazy sativa vape with additives. Peels your face back. Nobody wants that for their first time,
No.
Or
I'll take 5.
Or education on give it some time.
Yeah.
Like it's like I don't feel anything. And it's like 10 minutes later, I don't feel anything.
Well, that's too. And our tips for success. Is you need to
3
wait
hours. Forever.
But so back to that point about the education and just knowing what to do, we do surveys when we have these events, and 40% of the people say they didn't know the program existed. Because we asked,
that's a lot of people,
why haven't you gotten your card? Like 44% are like, cost a doctor visit. 40% are like, we didn't know the program existed. And then all the rest is just like these little tiny things. Like,
so like within
doctor
the industry,
turned me down, whatever.
Like within the industry, like we share but it's so weird. Like we have this little enclave, this like micro enclave of the community, the cannabis community on Facebook. And I don't think that our information that we share really reaches the masses the way we want it to. I think it just constantly the algorithm just circulates it among the community, and it doesn't so much reach outside, which is frustrating. So like
but we're getting them.
We are getting
through
them
our initiative.
Totally. But what I was getting to is that, we need bigger bones and bigger bucks to get to say, like if the DOH would say, hey, this is an excellent or clean medicine alternative, or if somebody would say,
we've been really pushing for public service announcements.
Yeah, we need the state.
So last November we started this, and then this last advisory council, I was
hey guys, y'all get behind.
Where are the public service announcements? Yeah, why is the state not saying this is our program? It's safe. It's, come join
they run it.
We sanction it. I mean, we know the answer to the question.
We know.
You already know the answer.
We know the answer to the question.
But
but we're still offering these solutions. Yes. Just for the sake of it. Because why not? We got to offer solutions. But I do think they are coming. Representative from the Department of Health told me that they are working on it. So we shall see how they come out. Hopefully they will be positive and not too too fear-mongery. It won't be too much about law enforcement and scaring people. Hopefully it'll be more positive about hey, this is a state sanctioned program. You're safe if you join the program.
Yep. Safe access, clean access to medicine, alternatives to opioids, that kind of language.
Under your mission statement, couldn't you do that yourself if you had the resources?
Yes. And we plan, if we can get the resources. So right now, essentially everything that we do, I've fundraised, right? And so through the industry, through private donors, and we have paid for everything that way. And so we've got a fundraiser in November that we're doing to try to raise some more money just for general admin stuff, so we can launch a membership campaign for patients, so that we can do more in the community.
I would think some of these other parts of the industry would be extremely willing to help if it was pitched right. We went up to a place up in Canton and toured through, and they had 1 out of 3 of their grow facilities there and couldn't sell that, couldn't hire the people they needed because they weren't making any money, and they had $26 million in the facility.
Earlier.
Lots of huge facilities in the state are going through that.
Yeah.
Like the bigger facilities are going through that.
Oh, well, so I'm thinking,
Oh, cool.
if I've got one of these and I don't have enough patients, what am I going to do about it? Well, I'm going to try and help get more patients. And you're right now, the most visible answer to that.
Yeah.
There may be others out there across the state, but.
Well, we were the first for patient advocacy.
Yes.
Specifically. So we will continue doing that. But I think that this has just been the kickoff campaign, the mass patient drive campaign, and we're going to expand our services and really get to work. But we need the funding, and this campaign's been a great opportunity to really understand what we need to do.
The gaming industry has an organization for Compulsive Gambling Council, and they contribute to that. In fact, the legislature actually contributes money into that council as well. Now, that being said, I don't think it's a very effective organization. But I think it's more of a sham. I was on the board and I got off because I didn't see it. It wasn't really there serving the purpose. Okay. A couple of billboards and a hotline, and that was about it. But if they'll do that for that, maybe there's some room.
Yeah, there's always going to be
organization.
There's always going to be sham organizations who, pitch that their mission is one thing and that they don't really do it. Right.
Right.
They'll just set up a website and take advertising dollars and run. Right. They don't really do anything.
Yeah.
And
that's a fact.
You know what I mean? That's a fact.
Like, you're best being honest. Like,
it's true. It's true. But then there are organizations who actually are doing the work on the ground and interfacing with the people. I mean, we're interfacing with hundreds of people.
And the thing is, like, we don't have an astronomical budget. We're on event by event. Listen, our social media specialist does a stellar job.
Yes.
Maria, our social media specialist.
Shout out to Maria.
But we have a literal cannabis army behind us.
Well, just so many people who are passionate about patient care and patient advocacy.
Well, and for the right reasons.
Yes. And they were, everyone,
not monetary driven.
Everyone was feeling a bit burnt out, right? And the patient voices came. And we kind of a
little fires, hey guys, under fannies.
We got it. We got it. Well, tell us what you need. We got it. And that's kind of been our mission, is to keep it going, because all of the advocates who came before us, the people who got the ballot initiative done, they're tired.
Oh, they're so tired.
We are like,
shout out to you. You know who you are. Thank you for us. Thank you from us.
Thank you to all the people.
I would say on this though is there's so many people that are just not ready to tell people that they use cannabis.
Stigma.
I think Doug said, I think he put 1 to 4. He was giving me some numbers earlier today. It's like 1 to 4 people in the state of Mississippi have used cannabis, and this is just. I mean, I'm not an expert either, but this numbers are going at there's so many people, and I can say that personally in my life, but they're like, I'm not ready to tell people that I use it.
So when I worked at Root Down, I worked at the Ocean Springs location. Thank you guys. I'll never forget where I came from.
Shout out Chase.
All of them. It's too long. We don't have time. I'm mad that you just did Lauren, Michael.
No,
Jackie.
but Chase is a big sponsor. Chase is the sponsor of the run.
Oh yeah,
Yeah, so Root Down and Starbucks.
Yeah, for sure.
Kind Life
Definitely.
and
Kind
Noble.
Life,
But what I was getting
Noble
at
Labs.
is, you know, we would have
Mississippi Patient Voice.
you know,
Patient
I'm at,
Voices.
you know, the Ocean Springs location of Root Down, and you know, we have all demographics of patients, like it's all walks of life, and there are professionals in the community that are fearful of losing clients or public perception or whatever if their car is viewed in the Root Down parking lot. So we just like stopped parking directly behind the building, and we're like, hooty hoo, get behind there, you know. But that's silly.
Yeah.
Like, why is it different for you to pull into the liquor store
Or pharmacy.
or the pharmacy? Like,
Yeah.
but I mean, but why are any of those different?
It just takes people a while. I mean, I'm
Yeah.
seriously.
Or the grocery store.
I'll call
for that
friends.
matter, or the gas station.
I'll call friends that will, if that's on social media or they make a stance. I'm like, man, I'm proud of you.
Yeah.
I mean, because I remember we were at Southern Sky, and I posted one of my first posts was we did towards Southern Sky. And I took a couple photos of me there and walked around with was it Stan? Yeah, it was Stan. I walked around with Stan. I think Stan Martin. Yeah. And I walked around with him, and we got to tour the whole facility. And I made a post, and I had nothing but like hate DMs, and I'm like,
What were the hate DMs?
just more like. That's not a good post, or but it's always like it was always more the older crowd, but like that was like it was probably about 15 or 20 that were like, I can't believe you're going to post this, and it kind of went into effect of
That's actually shocking.
Well,
really?
That's our biggest demographic.
Yeah.
well,
Those elderly
but it's
people.
just
Oh my.
it's the closest people is your family. So, but there's also certain people when it comes to, I've seen a little blowback with our charity, but I've had some blowback with the charity about it. But like these posts, and it's a situation where, but the thing is when you create a charity, you're able to do what you like, whatever you feel in your heart. Like it was us that, it was.
I don't know if you've noticed, but like, I don't think people are allowed to do good things anymore without getting backlash.
I just
but also like, I think it's a good indicator if you have haters. You know what I mean? Like if you've got a couple haters, like maybe you're doing something right.
I hate that.
I feel like if you can
it's a super shitty fact.
I hate it.
It's more like, it's more of the
also correlates with small pee.
It's more of a situation where you look at people like that. I get so proud of somebody that posts about cannabis. I do, because I've met some of the most fascinating people that have been a part of the industry.
Mm-hmm.
They're intelligent. They're not, of course everybody has a group of people that do different things, but a lot of people, it gets through the day. I mean, whether, it's good for anxiety, it's good for pain. If you just want to chill out and watch a movie, if you want to listen to some music,
you want to feel creative, you want to feel uplifted.
It does. Oh man, like
you want to go on a hike and like really feel the hike. Like, you know what I mean?
And it's a big part of like, normalizing this. And that's something that I believe in. I truly believe.
I promise you, I've never smoked a joint at night and then felt terrible the next day. I've never done that. Never in my life have I ever felt terrible.
I have a buddy
like directly after or as a hangover.
I had a buddy. He was a detective for 12 years. And I remember when he told me this, he goes, I've never had a situation.
You gonna tell me later who it was?
Yeah. But I said, I've never had a situation where I had serious problems with a person on cannabis.
Right? No, dude. Like,
he's trying to fight me.
Yeah, man. Like, sorry. Like, nobody's trying to like fight anyone. It's just, And
that stuck with me. That was a cool thing. Is like, because think about, what they're going after is meth, fentanyl, heavier stuff. I think the situation that we're
drunk people.
But, unfortunately, we still have people being incarcerated for having less than a gram of cannabis on them. Like that still happens. Like people still get taken in for like, it depends on where you are for sure.
It's all about cities.
It's all about where you are
and who you
what
know
you look like, who
that.
you know, where you are. There's so many factors, but the fact stands that Liz and I can walk around, we can go to a dispensary with our cannabis card and we can purchase our cannabis, get it stapled together, compliantly drive home with it. And people are getting arrested for less than that because they're buying it from the streets. Are they buying it from the streets because the medical cannabis program isn't accessible to them? They
didn't know about
They didn't know about it. What are the factors? That is what we are here for.
I will go on the
We don't want people to go to jail for something.
I'll tell you the biggest part right now is the media. I mean, there's a lot of people that just don't know how to get a medical card. I've had that question so many times. There's people that
I can't tell you how many DMs I get a day.
But that's how it's a serious thing. It's not like people don't watch. And I'm
glad you do. Keep doing it.
People don't watch cable that much.
Did your laptop just die?
Yes, that was on its okay. But I'm saying that one runs on this one.
Okay.
See. But the big thing is people don't have the education on like cable TV. There's no like talk about it. And if there is, it's a brief talk about it. So it's like, where do I go? How do I do this? And you can literally ask, talk to Dave about it. I've been able to be in text with friends. They're going like, I don't know who to go to. I don't know how to sign up.
Okay, so now just send them to us and we'll tell them.
Yeah.
Yes. If you're on the coast, Truly Family Healthcare or Green Aura Wellness in Biloxi.
And that's the one Doug sent me that I sent to Dave. So you have the situation.
Green Aura.
Truly, yeah.
So you look at the situation, people really don't know. They're like, I mean, honestly, there's people that are going to go, how do we smoke this? Like,
I mean, when it first started, it was like some doctors decided this is an adjunct to my practice, and they started hitting people up as much as $250. And then there was that mid-year test, another $250. It was costing you $500 a year.
My head might roll off my shoulders.
But there were
so yeah, we've even heard of, like people on their deathbed being charged $300 for a 6-month certification. And that's Banana Town. Why would you price gouge somebody on their deathbed?
Greed.
It seems unconscionable.
So, but that's happening.
And then there was a lot of predatory price gouging that happened at the front end that really scared a lot of people away.
Like, oh my gosh,
that's
so
still out there.
And that's still out there and it's still happening.
Still
and
happening.
So that's again
still fear mongering.
Again, part of the campaign is doing these $50 cards, and we actually have $50 doctor visits. And we actually have a statewide day coming up in November. I'm gonna have to come back on the podcast.
What about renewals? That's one thing that drove me crazy was these renewals. Like, I mean, you get a driver's license, right? Like, why do we have these renewals so early? Like we're 2-year-olds, and that was like a big thing. Is I didn't like that shit. Like,
and it's especially frustrating for the people who have conditions like that are never going to go away.
Yeah.
Like I'm pretty sure CPTSD never goes away.
That this came up at the last advisory council meeting, was some sort of exemption on multi-year or like doing some sort of multi-year card for people who have a chronic condition that's not going to go away, right? Like cerebral palsy or some sort of fatal, some sort of thing.
Also, I don't collect. I do not file for disability, even though I can get it. I do not file for disability. So this is why I'm super aggravated, because I actually work hard for my money, but I know what my pains are. And when I tell you my pains are extremely bad, and the only thing that's ever really helped me for my comfort is topicals and good CBD. And that's something that really we have to change, because it's like, that I just don't like. I mean, I got a driver's license. What is it? 5 years? What is that for a driver's license?
I don't know.
I think there's an 8-year now.
You can do 8 now.
You can do an 8-year now.
Yeah, it's longer than a cannabis.
And I'm 20. I'm 39. I'm 39 years old.
Yeah.
So there's been some discussion about having a 24-month option or some sort of, thing where caveat where if you have a terminal or permanent condition that you don't have to keep going. But again, there's people, everyone has an interest. To me, there's like 3 main interests there. Well, I guess 4 if you think about the state. So, you've got the practitioners, the patients, the state, and the industry. Right. And those are the 4 interests. And sometimes one is going to be at odds with the other, so anyway, that it'll be interesting to see how the legislature kind of handles all those things. But I think every entity in that that conglomerate's going to have an opinion about how often patients need to see physicians.
And maybe it varies across conditions or whatever.
How, in your experience, how many physicians are actually out doing cards?
Gosh, I had the number the other day and it has shrunk drastically. I feel like,
oh, I wonder why.
I can't remember, but it has gone down from where it first began. And I don't remember, but I do know there's a lot of counties that don't even have a practitioner, but I don't know the correlation of if that's a county that opted out and they don't have a practitioner because they're not even part of the program. That's the data that we don't have. There's a great website called thc.ms. It's called the Health
Shout
Council.
out to Jay Mason.
Shout out to them, Truman. But he's got a list of prescribers, cultivators, processors, like everybody in the industry that you can reference and help find practitioners too. And so we have that website linked on our website so that people, because he has a really great patient resource guide as well.
Yep.
He's made all these
terpene guides
and then condition specific recommendation sheets, right? That talks about like this type of condition, what you want to achieve, like what types of cannabis products, what type of terpenes that you should use,
different administration methods and things like that.
Since the industry came, I guess the first question that would come to most people's mind when they hear about it is, what's a terpene? I mean, it's a whole new way of thinking. And
that's the vocab that we're talking about, right? So the first time I'm at the dispensary, they're asking me, telling me about terpenes. I've never heard this word, right? And
I'm like, let me smell it instead.
I'm like,
and we can't do that.
Yeah, we can't smell it either. But
so we don't know.
So the terpene, and while we're here on the podcast, I'll explain what it is. So essentially, it is that aromatic compound that is on the plant essence. Essentially, it is these little tiny trichomes, these resin glands that come off of the plant.
Look like crystals.
Yeah.
Like
now tell us what a trichome is and a resin gland.
Yeah.
So you're crushing it. Look at you with the lingo.
So a trichome is this cute little guy. He kind of looks like a mushroom, and they're all over the plant. And essentially that's the medicine that you're getting. And so when you make concentrates, for example, all you're doing is getting those little trichomes off the plant and converting that into some sort of concentrated medicine. But yeah, like when you smoke your flower or whatever, it's the terpenes on that plant. And for example, when you're eating fruits and vegetables, right? Those compounds in the fruits and vegetables are what are providing you with nutrients. And when you eat vegetables, you want to eat the rainbow. You want to eat all the colors that you can. You want to eat your fruits and vegetables all throughout the day. Similarly, like, they'll say, red wine has these good properties, resveratrol, or adaptogenic herbs have these, compounds. Similarly, that's what the terpenes are on the medical marijuana plant. And that's why it's medicine.
So you have a law degree, or do you have are you a dietitian?
I have a law degree. I'm an attorney, but I did take, there's a course called Cannabis Healthcare and Medicine that I took through LSU because as an advocate, I wanted to be the most educated, impactful advocate. So I fully understand the endocannabinoid system and how it works with the body, and just so much amazing information that I wish more people had access to, but that's why I'm out sharing it.
Yeah.
Sharing my knowledge with people. So yeah, are we podcasting? What are we doing?
I'm waiting on her so we can. She's Jenny's restroom. We're back.
We're back. Do we cut it? Do we edit? How does it work?
No, just leave it live.
Just live.
Just hop in. Yeah.
Don't sit on my.
I didn't know we could just leave during the podcast.
Oh man, I've had stomach issues.
Okay.
No, me though. I'm saying me. Like no, it's a live show. So
I just felt self-conscious because I'm the one with IBS and diverticulosis.
Yeah.
So I was like, "Are you calling?"
I mean, I wish I could. I mean, this is like 316, I think. So, but yeah, you just have to because you're doing these. If you're going in these kind of conversations, I guess if you're not doing live, you can cut it. But people understand that. I mean,
okay.
I'm pretty sure they got.
I'm just not used to this.
Yeah, well, I mean, I'm pretty sure they're gonna go take a pee and
maybe take a toke break.
Yeah.
Yeah.
While y'all doing that, we did terpene 101.
Yeah, we talked about
I heard about the
terpene.
terpene
I can hear you.
101. Yeah, that's amazing.
Yeah.
What are your top terps? Let's do some terp
Terp talk.
topics. What are your top terps?
I'm still
Do
learning.
you have any terps that you want to talk?
I am not. I'm not like a little baker. You're a little baker when it comes to stuff like this.
Limonene, linalool.
So my faves. So funny story. When I first started at the dispensary, I thought that I only needed to consume indicas because I had anxiety. I thought that sativas would give me anxiety. False. I love the gas.
Everything with the indica sativa is not true.
It's
not true.
And like
indica's not in the couch.
No.
Sativa's not uppers. It's actually
you need to find what works with your body because everyone's endocannabinoid system is completely different. How you receive these terpenes and how they interact with your body.
You can also have fun with.
Board.
I've also always enjoyed using different both strands.
Yeah,
go back and forth.
I love blends, blending them together.
Well,
hybrids.
John Jordan told me this, and I will always been this is John Jordan kind of life. He's like Jordan. He said, "There's so many." He goes, "I don't really know if there's an actual indica and a sativa anymore." He said they're all hybrids.
Yeah,
like, I think they're all hybrids.
Yeah,
cross genetic, all the things. Like I can't talk like a grower. I'll never.
No, but he told me John Jordan is he is an amazing grower. He makes it his life's work. Like you
meet some interesting characters that grow weed.
Well, he just
I love them all.
I mean,
me too, for sure. But like, they're so diverse. Like all of their backgrounds are so diverse. And like
all the ones I know just
really nerdy.
Weed, so.
Yeah. Like
their backgrounds are weed.
Well, most of them, yeah.
Like
personality wise, some of them are like super sciencey and nerdy.
Oh, his flowers are his babies.
Yeah.
I mean, he takes it serious. This is babies. Mm-hmm. And he'll sit there like,
I think that's probably every grower.
Yeah, he goes, what he said. I mean, if you go back and watch the podcast I did with him, you'll hear like, we're
going to have to do that.
He moved to Denver and, he got in some trouble over and he got some trouble and his parents, they have a nursery and Moss Point
has gotten in trouble.
And his parents were like, let's grow legally. And I think he started with just regular flowers, and then he started learning, and they started their facility. And Kind Life is an amazing group, but it's like I call him and like he's like, dude, it's like you give me anxiety, call because he wants to make the best F strand. Like, and I'm like, dude, like I appreciate you just wanting to be a part of this and. Like, because there's ups and downs with grows. And
my goodness.
Nothing's perfect.
I can't even imagine.
Every time.
Every
time you cultivate and harvest.
Alive. Like how it blows my mind. Like, because just one little factor could completely derail a room.
Just like beer. Just like with flower.
Oh, yeah. It's funny because Corey and I, whenever I was in sales, at the end of our day, we would kind of deliberate about production issues, which is super funny because the production issues in cannabis are very similar to beer. Like, oh shit, I oversold that strain. Oh shit, I oversold, that, pumpkin pie, whatever, or whatever the beer is. So,
it's important, but it's a very, the people that do it, they do it with passion. Mm-hmm. And it shows by their groups and how they put their heart into it. And it is a fascinating industry that you're taking on. And I just can't believe y'all pulled out 1,500 patients so far with get cards because that's no time
either.
That's no time though. Like now they're at 62,000 and there's 3 million people here. Is it 3 million? Yeah.
We have a long way to go. Clearly, I can't even begin to fathom how many people want access to this and either don't know that it's obtainable or equitable for them or don't even know it exists.
Wait, hold on. The whole state of Mississippi is only 1 million people.
1.1.
Is it one? I was thinking 1. I was thinking 1.5.
Go Lord.
People are leaving. People are mass exiting here. Brain drain.
And the numbers that you're talking about, 1,500 people basically in 3 months, 500. That's
massive.
125 a week.
Yeah, that's math that like my brain
That's
just can't
incredible
really.
number.
Yeah, we like I said,
Yeah.
we're shocked
Cool.
every time. Every time it happens, we're just like, whoa.
Yeah.
And we keep waiting for the double back where it's not as big of a turnout.
I will say my favorite part of a drive is when I get to do the math at the end of the day. When we go to the practitioners, I'm like, how many? And then I get to add it all up and I'm like,
It's always exciting. It's exciting.
Well, because like we see so many people that are they just want relief.
When they arrive, they are stressed out. They are frazzled. They are on the edge of panic attack. They are wincing.
I can't tell you how many people I've sat with and I'm like, babe, you're good.
Like
it's
people,
cool.
I've been there. I've been there.
You're fine.
When they leave
like,
after having seen the doctor and they leave, it's like this huge weight has been lifted off of their shoulders.
They hug,
you know,
like it's
they're
bananas.
just like, thank you. And it's incredibly rewarding. And
so rewarding.
That's kind of how I got into the industry side of it. Was I was just a patient and an advocate, passionate about it. And people would come to me and they were afraid. They were like, I don't want to talk to my doctor. I'm afraid I'm going to get canceled. Or my mother-in-law, who's elderly, not tech savvy.
I'll open it up for you.
Thank you, friend.
And so I was just helping people, giving them the reassurance, helping them set up appointments or like taking them to the dispensary, like just helping people.
Yeah.
And I was like, people just need help.
Well,
You know what
I mean, that alone, like, let's talk about that for a minute. The daunting task of visiting a dispensary for the first time. Like, as someone who's never navigated cannabis, or even somebody that's like a tenured, like, holla at your boy, and, you know, that exists. You know, there's a lot of people who have been consuming cannabis for a long time and they're like, oh my God, this is so stupid. I don't want to have to call this person to call this person.
I'd rather just have my con bud.
Yes. Like, oh my God, this is so dumb.
I'm calling my loop again.
Yeah.
You know, but navigating the dispense, I can't tell you how many people have asked me to be their escort.
Yeah.
I'm like, yes, field trip. I love taking someone to a dispensary the first time, not as much as experience someone's first grow.
We teach that too at the expos, right?
Well, yeah, they can interact with the different
they learn about the allotment system. They learn about the vocabulary. They learn about what they need to bring with them to the dispensary, because you have to
how to pull up their card on their phone.
Yeah, how to pull up your card on your phone.
That makes that right there is difficult.
Sweetheart, listen.
Let me tell you about the tech table. They did it on purpose. That's a definitely like, come on, that.
I think we really need to spend a moment on the tech table.
I mean,
it's horrible.
We are like taking people's pictures. We're uploading driver's licenses.
And you got to get to approve.
We're doing all the
stuff.
For people who don't have email.
But you got to wait for being approved too. It's like,
but listen, Monday morning, people start getting their cards.
Yeah, they'll message us.
Yeah.
They'll message and be like, whoop, going to the dispensary.
And we've had the Department of Health actually come to our events.
Oh, thank you, Miss Tracy. I hope you see us.
Because again, practitioners were trying to get us shut down, and so they would make these bogus reports. And so eventually, after so many reports, they were like, let's just go out. And they came, and I feel like someone from the nursing board was there too. They spent a couple of hours, and they were sitting with patients. They were observing us and that was our highest volume drive to date. And they showed up to. They were testing and quizzing and just really kind of vetting it and making sure we were HIPAA compliant, that we were actually teaching people how to do their portals. Because a lot of people don't know how to do that, and they'll call the state all unruly about this or that. And they don't even know. They're like, what is a portal?
And they don't know how to navigate it.
So we teach people, empower them. We're like, no, you have to learn how to do this.
I will say that was the best feedback we got. Tracy said, Miss Tracy with the Department of Health, she said, thank you so much for empowering these people and teaching them how to navigate the portal, what the portal is, how to navigate it, how to upload their own things,
hey,
how to get their own license.
If you're listening, it is tough. Like I will say, because like I have my insurance license. It reminds me so much of me doing.
Good Lord, you got to jump through fiery hoops naked to navigate.
Because it goes different ways, guys. So, I mean, that is something that y'all have to like. I figured it out, but I was like, similar to like my license, like you have to wait on you can't just pass and then think you go into this dispensary. Like you got to get approved and you got to get a digital card. And then you got the best thing to do on a digital card, save it to your phone, but print it out and laminate it.
Well, similarly, it's difficult to get an agent ID. You have to have an agent ID to work in industry.
Most dispensaries will print your card for you now.
Oh, yeah, definitely.
So that is nice. But yes,
you download it to your phone.
Downloading it to the phone.
But also there's some dispensaries. I'm not going to name their names, but there's some dispensaries that just they're not. I mean,
they don't want to help you with that.
I mean, there's a lot of them.
That's weird because you need that to make a sale.
If you want someone to buy products,
that's weird to me.
Yeah,
but it is that way. Like, I mean, I walked into some that are like.
Well, maybe these are the dispensaries that have ownership in other states that don't have.
Well, I think there's also kind of like that gold rush. Everybody came in and thinking this is a gold rush. In reality, it's not a gold rush.
No,
it's a pennies rush.
No gold is rushing.
It's a copper rush, maybe.
I'm close too.
Are you rich? You rich? You sitting here being
rich?
He
closed.
No, clients.
Closed too, like closed.
Like
okay, like
closed.
They're not okay.
Cannabis businesses have closed.
Yeah, it's not. And that's the frustrating thing with getting any kind of pushback with providing subsidized cards. Nobody's getting rich in this industry. I guess if there were people getting super rich, that would be a reason to get mad. But Mississippi is one of the poorest states in the nation. Like, that's not a surprise. Like, why are we?
And if you're not, if you want people to pay those prices, you have to go after that demographic. Yeah. You know what I mean? You gotta find them and market them. And like, we're talking about professionals and how they don't want to be seen at the store. I mean, we need to be talking to these professionals, teaching them about medical cannabis instead of drinking their lives away. Because that's what they're doing. Mm-hmm. Lawyers, we had to go to a class about substance abuse when we became lawyers. And I myself quit drinking in 2021 because I was using it as stress management, which is not good, by the way. And I just was like, this isn't sustainable. And that's the best decision I've ever made. But I think having medical cannabis come in after that, right? Because I quit drinking and then soon thereafter we had medical cannabis. And that's really saved me. I don't know if I could have maintained that without having access to medical cannabis.
That's a huge thing. It's just, like I said, go back to education. It's DMs like for me or DMs like for you. Like when it comes to like, hey, I want to do it.
Yeah.
But what do people think of me? I'm like, because they'll see my like the way you post. If you the way you post and share your experience, like I'm very open about it. Yeah. I was so excited when I partnered with Con Life, and I was like, but you have people that are like, hey man, like I need help. Like, I don't know any of this. Like, I want to, but like she said, I'm worried about job security, clients, people do really, I mean, not everybody goes this. We all live in our heads. We all have issues. Nobody's perfect. That's a real thing though. I mean,
church.
But no, it's a real thing. People go through a lot of like emotional stuff, and it's like, I just don't think cannabis should ever be like, if you can go to a casino and gamble, if you can go drink alcohol.
There are such worse things.
Yeah, that's what I'm saying.
There are such worse things.
But it's just the way
I'm telling you, cannabis is not the thing to be closeted about.
My brother lives in California.
Things.
He's from Bay St. Louis. My brother's been in California. How long has Michael been in California? 25 years, something like that. He makes fun of us. He's like, well, like for him over there, he's in Anaheim. He's like, this is weird. Like, because over there, you just go in.
Yeah.
There's security guards in there, and it's very affordable, and it's not even a conversation.
Yeah.
Well, but that is a rec market too.
Oh yeah.
So there needs to be like, it's a different experience. And while I, support that, I really would be very concerned about losing the medical benefits of the program by jumping into that too quickly. And everyone's going to hate me for that, but I am, like patient first, like, this is medicine.
Yeah. After my most recent trip to Denver, I went to a rec dispensary. They now have, they still have a medical program. So your better concentrates, your better flower, your more medicinal products are categorized. And I am not a professional. Like, I don't know all the ins and outs, but this is my understanding of the Colorado program. They have the medical market separated. That's your better quality things. You're more medicinal. But then I went to a rec dispensary, and it just, sure, you can just go buy cannabis, but is that really what we want? I don't know. That
is what some people want.
That is what some people want. And that is fine. So sure.
I'm telling you right now, I mean, on the situation.
I'm not going to fight anybody.
No, but if
I want everyone to have what they want, because at the end of the day, that's a better America and that's a better society. Like, within the safety, like, be safe, be responsible.
I'm saying that you still, for me, it would be like if you're like a Starbucks and like you're paying to the state and they're vented. Like, if you get them, like, you're spending a lot of money to be in business.
Right.
I'm not saying gas stations sell. I'm saying a real operation, go in.
That's like that's a whole, we can't even open that can of worms tonight.
I know, but like, I just think for me at age of 21 years old, after 21 years old, if you can go and buy alcohol and you can gamble and you can spend all your money in the bank, I feel like you should be able to be.
You can fight for your country.
Huh?
You can fight for your country.
You can do anything, but it's like, this is such a situation where it's healthier than alcohol. It's healthier than so many other things, but yet you still have to be regulated to a level of, like, I mean, I don't know. That's just me saying.
Well, we all know why.
Well, so here's an example of a similar subject, is that our statute requires that people who are 25 years and younger have to see 2 certifying practitioners, which means a double burden on them. But, why? Like, if you're 21, if you're otherwise emancipated under the statute, let's say you're a veteran.
Jury duty? You have to do it?
So how many kids are walking around illegal because just the cost of cert is,
and so that's been
unreachable for them.
Yeah, that's been big on our campaign too, is that those people can come and see 2 doctors on the same day. They can't be from the same practice, but we have 2 different, practitioners, and they're able to do that because we bring that service. But that's another thing that we've brought up to the legislature and the advisory council before, is that we need to do away with that. Maybe for people under 21, if you're still a minor, maybe you need to have 2 certificates. But even still, if you're a child who's having uncontrollable seizures, you shouldn't have to go see 2 doctors for that either.
Well, yeah. I mean, there's a lot of things
but a lot of this is liability.
Yeah.
I know that the liability insurance provider through the state kind of makes the rules. And so I know that practitioners are kind of hemmed up by those entities as well.
And then even if you are a nurse practitioner, you have to be under the guidance of a doctor. So those are additional fees.
Well, anyhow.
What is it? Sir?
That's the rule anyhow.
Well, I know that, but like, that's additional fees that they have to pay. And those fees are astronomical.
Yeah. Oh, they are. When it first came in, everybody talked about, 5-year rule. Every state that comes in with medical cannabis, within 5 years, they have recreational, and that's kind of the pattern around the country in other states. Mississippi's not a 5-year state.
Yeah, no, I don't feel that way either, unfortunately.
Unless we can really shake up the legislature.
Yeah.
With some elections.
I will say, like,
not going to happen. Not on this issue.
Can you let
us just like live on this hope?
Let a girl dream. Can you let a girl dream?
Can I just exist on this cloud?
Like, we're gonna affect change. Let us believe it.
Let us just hope and change over here, okay? Dang.
I made sense real quick. Hold on. I told you earlier when on the golf cart, I was like, you gotta have Scott on here.
Yeah, I know. Right? Here, let me drag you down a bit.
I was just going to say,
put you back on reality.
We got to get rid of some people because they're standing in our way.
Yeah,
well, and like the thing is Mrs. Oh, go ahead. I'm sorry.
I was going to say, my clients don't pay me to tell them what they want to hear, but what I think the realities are and what can be done.
That's a good lawyer. You got to tell them what they need to hear and not what they want to hear.
Yep.
Yeah.
For sure.
I don't remember what I was going to say. Probably wasn't very important. Came and went.
Well, we were talking about about change with voting and stuff. I think it's been
Mississippians vote against their own interests.
It's weird.
That's what I wanted to say.
All right. Well, we're a nonpartisan organization.
Remember that voting thing they did? Forgot, but it was so tricky. It's like you're putting a tricky question. Like I forgot what was that? The vote yes or no.
Oh, the ballot initiative? Is that what you're talking about?
That was weird.
Like they love to confuse us. It's their favorite.
You didn't know if you're going to vote yes or no. You're like,
it's like,
do I click this? Do I not?
I think I just said maybe. Maybe we'll get it.
But that was real.
Reminds me of Life Aquatic when he's like, "Don't cross this line if you're not with me." And they're like, "What? Did we cross the line? What are we doing?"
I think the biggest thing in my heart it makes me feel is as long as we doesn't matter what we do in the community and how we really put our hearts in when it comes to make these decisions. It's not really, to me, it feels like not the community that's making these decisions.
No, it's definitely not.
It's not. It's just other. It's people that probably have never experienced it. And I really know.
Mostly, unfortunately,
it's just a weird situation where you're like, man, look, if I could put 200 on black, come on now. If I could sports bet, come on now. Let me get a gram. Let me get a $40 gram of weed.
Well,
maybe a book.
Don't buy a $40 gram of weed.
Yeah, I don't buy that. Well, that's the spirit too of Mississippi Patient Voices is to amplify those voices. We've been collecting stories online and sharing them, and of course now I'm spacing out, but the point is to have the legislature hearing from more people, so they aren't just deferring to these committees, and that their constituents are medical marijuana patients, and that their legislator needs to represent them. And so, we really just want more legislators hearing from their constituents directly, because you're right. They don't know what the people in their, district need if they're not telling them. And so we want to, advise our patient members too about how to vote.
And be vocal. Just tell your people what they need.
This person, isn't supporting your medicine, and this person is.
Tell your people what they need.
Yeah.
You know what I mean?
The initiative had a lot of, I think, positive benefits of it. One, the numbers were huge, which sent a message to the legislature.
The only reason
which really kind of argues against what I just told you a minute ago.
Yeah.
But the blessing is it was in the Constitution. We couldn't amend it. It was a flawed bill.
Yeah.
And the bill that we got was so much better. And now we can work on it because it's a statute and it's subject to change with input. If you put in the Constitution, the only way you do it is amend the Constitution.
Right.
And that's not, right now, we don't even have an ability to do that.
But yeah, so that's the point. I know, with the legislature as it is now, we're not going to get our way. But my thoughts are with Patient Voices is that, we let the people know how to vote, and that this person supports your right to medicine. This person doesn't.
And that's already happening outside of Patient Voices too. I feel like there are a couple people in the community that are kind of tapped in and doing that as well. So we're not a sole entity, which is great. We've got other voices behind us echoing what we're saying, and it's bipartisan. It's not, the left's saying this is the right saying this. Within the cannabis industry, it's, hey, this person supports your freedom to use cannabis as medicine. This person does not and wants to take that right away from you. And I think that that's very important information for
voters.
How do you identify them?
I am independent.
He's asking how we identify those legislators.
Yeah. Which one supports and which one doesn't support?
So there's a lot of different ways. Similarly, the way lobbying groups gather information. I think you could probably tell us more about how to find out who's who. But I'm
not going to tell you right now.
Well, I know you won't tell me right now.
Fortunately, a lot of these people are outspoken about what they support and what they don't support. So more of that would be great. But of course,
So we've got, resources that we're going to tap into to identify those.
Okay.
Yeah.
You'd be surprised the number of people legislators that support your issue, but don't feel like they can vote for your issue.
Well, of course not.
That
Right,
happens a lot.
Yeah, no, for sure.
But
and we're aware of that.
If you identify those, that's when you target some of the people
when you can have
back in their
independent conversations
district to have people call them from back home.
Yeah, exactly.
That most powerful conversation with the legislator is the one on the
fence.
No, the one on the steps of the church.
Oh, okay. Yeah, exactly.
Yeah.
And that's what we want people to do is feel like they can talk to their legislators about that type of stuff, and not in a confrontational way, but in a way that says, hey, I'm your constituent. Like, I use medical cannabis. Let me tell you how it's helped me. And then that legislator can kind of see that a patient is a person, is a constituent. It's not some kid trying to party, that these are real people and this is really helping. And if the legislator doesn't get that information, they won't know how to vote.
Yeah.
Right.
It's
for their constituents.
It's a lengthy process, but it does work.
It just needs to start. You know what I mean? You got to start somewhere.
With all these places, like the more rural places that we visit, how do we empower those people to feel like their voice is going to be heard if they contact their legislators? Because I feel like that might be a barrier.
We got a plan to develop.
Yeah,
that's and that's what we're trying to fundraise for in November is time to really carve out a strategic plan for all that.
Like we just at the end of the day, like we want to empower everyone in Mississippi to use their voice, to advocate for themselves,
and to not feel afraid.
And,
or
we see this even in our individual patient drives. When I work the tech table, we see a lot of people who are very easy to give up, to throw in the towel.
Yes. A lot of people
very easy to throw in the towel. Like, oh God, this is so hard. I'm just going to give up. And I just, it's hard enough to exist if you're, of a certain socioeconomic background, if you have to fight harder to survive day to day, if you have certain obstacles and you just prioritize your life based off of, what you got to get done that day to survive. And
literacy issues as well.
We have major literacy issues in the state. Like the things that we are seeing in patient drives are Mississippi specific problems that are literacy related, accessibility related, equity related. Sorry. And it's not like just cannabis. It's these people haven't had an equitable chance because of where they live, or
it's important though. You can't solve all the problems.
Oh no, I know.
And
for sure.
You see these and you run into them.
Mm-hmm.
It's just
we just want to make it better.
There's a phrase that I didn't come up with, but the main thing is the main thing.
Mm-hmm. The main thing is the main thing.
So that's where you need to keep your point of focus.
But still, those are factors that make the cannabis program, like we need to know these factors so we can overcome these obstacles to the cannabis program.
Because if you are not technologically literate, or you just can't read, if you're trying to go on the portal to register and you need information, and then you have to read the application, all the questions and attestations.
It's a fucking rabbit hole.
You know what I mean?
So we have people, let me just give you some scenarios.
Yeah.
So we have people that come and there's a group, maybe they're a family, like mother, father, child, their toddlers with them, and they use one debit card to do all the state fees, because that's the only person in the family that has the debit card. Or you have elderly patients that
use my card.
Or Elizabeth's like, cool, I'll just use it. You can Venmo me, cash out me, snail mail me, write me a check. Allegedly.
Yeah.
But and then we have We have people that walk in and they'll sit at the tech table in front of me and they'll say, I need a cannabis card. I'm like, do you have a phone? Nope. Do you have a debit card? Nope. Do you have an email address? Nope. So where do we start? We start with an email address.
Create an email address.
You know, this is your login. This is how you get there. I'm going to put the app on your phone. I'm going to give you a little technology lesson. And then we're going to put the MDOH app on your phone. We're going to show you how to access your license. Like if they retain that information, like I super hope they retain it. I write it down for a lot of people that request it. Again, we're refining that process. But at the end of the day, like if these people aren't empowered, and I think that that's a holdup too with going to some certifying practitioners, they may not have the capacity to sit with someone that isn't technology savvy for 45 minutes to an hour. There are practitioners that do.
So the big scare is the tech side of it. For
what is it?
The tech, just like to sign up. I mean, even if they have,
like you still
a driver's license should be good enough, like to sit with somebody. And I mean, because you're going to give out your number, your driver's license number, your age. I mean, your
social.
Yeah, So, but you still got to have a phone and a debit card.
Yeah.
Can you use like a Cash App or no?
You don't have to have a phone, but you have to have some sort of debit or
technology
credit card
to act like.
Do you have to have like a bank card, or you can get like a Cash App?
It has to be electronic bank card.
But what? I mean,
wait. You can ACH. You can ACH.
Oh yeah, that's true.
So,
and disabled vets have a waived application fee. And if you have your blue Medicaid card, it's a half price application fee for those of you who don't know.
That's pretty dope.
Yeah.
But there's still a lot of steps.
It's still a lot of
it's
steps.
wild.
And even at the drives, people are like, there's another step.
And you know what? Like full transparency, sometimes in the middle of drives, I'm like, I don't even know what your next step is.
I know.
I'm unsure.
Look at the scary.
Hold on a second. Let me just.
Yeah.
I think I have to pee and drink some water.
Well, you know, and the number one is like you go through the process and like I said, get it done and then get it approved and then go to the dispensary for the first time. And you're like, you've already been traumatized by just signing up.
Like there honestly, there are really a lot of steps.
But you can go take your card and sign up and get your voter registration card and go vote easier than you can get a medical card.
You just send a piece of mail off it like there's no picture on it. There's no nothing. Like and then you're registered to vote.
I walk in my priest. Okay.
Yeah.
You don't need an IT specialist.
Yeah, and after you've got a card, you show up to go in.
Right.
Well, you got to.
Where's the card?
And then you got to like build up the courage and gumption to talk about terpenes.
Check all the cards and all that. Then you have to wait until someone opens the locked door.
Oh, wait, no, it shouldn't be like you can just walk into the lobby. It shouldn't be like,
no, but you got to go back to the room.
In the back,
they got to check you in.
Yeah, they have to check you. That's my point.
So
it's kind of intimidating.
Oh, yeah.
It's kind of intimidating to do that.
Yeah.
Come in.
Yeah. And so that's intimidating. So every step of the way is intimidating. And that's the point of our events is to take all of the intimidation out.
So like if you've met a bud
all
tender
the community
before,
support,
which is still a funny term to me, a bud tender. Isn't that funny? So if you've met a bud tender before and you've met like dispensary people, it seems a little bit more navigable.
Well, if you see a familiar face, right? Like I walk in, I'm like, I saw her the other weekend, you know?
Right.
And that does happen. People come to the dispensary and they're like, I saw you were helping or whatever.
Yeah.
And they're already.
Am I saying like concierge? Like what was you say that kind of like situation? It's kind of like a casino host to me. Is like an executive host that the best bud tenders for me are the ones that really know their shit.
I would say it's like a cannabis sommelier.
Yeah, there you go.
Mm-hmm.
But
a gangier.
You could find, but the ones you find, you could tell they're good. Like you're like,
oh man, and
fill my bag up.
There are some incredible bud tenders on the coast, and even up north. Like we really do have like some very passionate cannabis industry workers. Mm-hmm. That are just really moving the needle and, you know, behind the whole initiative to just grow the program. And shout out to those people who aren't about the drama and like do the thing to just move the program forward and be about the patients and the cultivators as a whole and the processors as a whole.
So you nailed on the fact that you want to come back on. So we're at 2 hour mark. Y'all will be out the Pink Dress Run October 18th.
Yes.
It's a good time to meet.
I will be there. See you there.
I'll be there.
Yeah. So you'll be able to meet them and spend time with them. And, you know, if you're thinking about getting your card, get your card. Yep. Also, let's just go over a few things. Thursday, October 2nd, Margaret's got her pink dress pop up at Chandelier with Gina and the crew at Chandelier, Alyssa, Katie, the whole team. But it's $20 donations if you want to buy a dress. We got over 100 dresses. It all goes to the Memorial Hospital Foundation. And then come out Thursday, have a good time. If you hadn't picked out your dress, come donate, get a dress, hang out. October 18th, we'll kick off the run. It'll be 9 a.m. Registration starts. You can get your tickets at pinkdressrun.com. When you get there, we're going to do probably around 10 o'clock, I would say, maybe 10:30. We're going to kick off what you call Survivor Talk. Okay, Survivor Talk is people that are going through cancer, just discovered cancer, been through it for a long time, but we get on the big stage and we let anybody that wants to tell their story. That's one thing is you get to hear people's stories, and it's emotional, but just keep in mind that it's good for them. It's good for everybody to hear their story. We won't start the run until they're done. So I don't know if that's going to be 15 minutes or it's going to be an hour, and then we hit the national anthem and then the run starts. So I think normally the run runs at 11 o'clock. It depends on the survivors and how they feel. But they'll be out. You can they've got nurse practitioners coming out. You got so many other things. We got Biloxi pickleballs coming out, or the pickler. There's so many vendors out this year. 100% of our money is going to the hospital. We do not have a bank account. We've been able to raise over $600,000 plus for our community. This is important. And also free mammograms. If you sign up for the run, we're offering free mammograms. And I know there's a lot of people that reach out on the phone and talk about it to me, but this is your opportunity to come out. You'll do a screening. If you feel like you want to get a voucher because that machine's so big, you'll have a free voucher to get checked out. There's so much going on. It's from understanding the cannabis world to hanging out with the Pepsi crew. It's the
Shandy crew.
Yeah, I mean, but it's so much. It's our community event, and we'll have the mayor kicking it off too. We'll have a lot of people out there. Bring your lawn chairs. Meet your friend. There'll be DJ, music. Have a good time. But yeah,
what's that lineup?
What's
the music lineup?
Well, we're kicking off Chandelier, and then around 3, I think it's around from 9 to 3, and then we're going to kick it off. Like we're going to probably have one band coming in. But we also had Fly Llama hit us with the same date, which Dave pushed it back till 3 p.m. And we'll probably kick off and head out to Fly Llama after.
Perf. But that's where I have to go too.
Well, that's what Dave's like, dude, I did not. We've always done the run for last. It's like 8 years. We've done it on the same weekend.
So were we fighting Dave?
No.
With friendship?
No. No, he moved it back. It was going to be what, 12?
Well, no, I think it starts at like 3 or 4 now.
Yeah, he did it for the run.
3. Yeah.
Because he called Gina and he called me.
I love that.
But he did start the Pink Dress Run with me.
Yeah.
So Dave was a big part of it. And Dave was so proud. He called me right when he found out we had free mammograms. I think going forward, we're going to be partnered up with Fly Llama 2 and Chandelier and other breweries and
growing and making the initiative stronger because it's really just about helping.
We're not too full. We're going to hit 1 million. We're going to hit 1 million.
Yeah.
But people like y'all coming out and being a part of it, I have their information in the link. So if you want to check out, it's was it the
mspatientvoices.org or Mississippi Patient Voices on Facebook.
And reach out to me or reach out to them. And if you got questions, we'll answer them. See y'all later. I guess we got to hit the live here. Hold this, Scott.
Information is not a controlled substance, y'all.
Information is not a controlled substance.
Thanks for having us.
Thanks, guys.
Let mom know. Let mom and everybody know. We still haven't figured out the chat on the restream. So guys, if you're responding in comments, we'll see it later after the show. We just hadn't figured it out.
Love you. Sorry. We'll deliberate.
Yeah, we'll
without you knowing about it.
Yeah. See y'all later.
Bye.